So now we're moving into another portion of the evening for a bit of a conversation. I'll have each of you briefly introduce yourself and what occasions you being here. We'll have a brief discussion together, and then we're going to invite some questions from you, and so you can think about that. And then at a certain point, I'll indicate that if you would like to ask a question, you can come up to the mic over there. So for now, why don't you begin and just share what brings you here today, and maybe some, that can be how to begin.
So my name is Dr. Mary Heilman, and I am the clinical ethicist at St. Paul's Hospital, and I also serve as the ethicist for the Catholic Health Association of Saskatchewan. So serving as Chaz's ethicist, part of me being here today is just to help with understanding that hospital side of care, that healthcare practitioner kind of side of things.
Great.
Hi, I'm Dr. Leonie Herx, and I'm a palliative care physician in Calgary. I've worked in Ontario and Alberta, and in both adult and pediatric palliative care. I've been on the front lines of experiencing what it's like to have work in a healthcare system with legalized euthanasia and conflation often of euthanasia with palliative care. Thank you.
I'm Amanda Achtman, and I work to prevent euthanasia and encourage hope through a cultural project called Dying to Meet You. And I also work on ethics education and cultural engagement, giving formation to medical students through Canadian Physicians for Life. And so here we are to engage some of the themes that have come up this evening, some of the perspectives shared. And so I think I'll begin by just asking both of you if you would like to comment on what we heard from the testimonies.
Sure. I think as I listened to each of you, Katerina and Sheila and Linda and Peter, what struck me the most was something that I experience in my own work on a day-to-day basis, and that is the need for safety, the need for safe clinicians who don't suggest to you when you're at your most vulnerable, like Katerina, that you would be better off dead and that we should assist you in your suicide completion, but we need to do suicide prevention. Safe families who love and treasure every member, even those who can't speak for themselves. Safe spaces, hospices, long-term care homes, hospitals, that people can go to without feeling the pressure of euthanasia, where they can be cherished like till their last breath, like Linda's dad. And safe laws that protect people from euthanasia for reasons like I think I've experienced working in federal penitentiaries in Ontario, and euthanasia was allowed for prisoners who couldn't get parole and were suicidal but had some other chronic condition that made them eligible. And I think that our laws in society aren't doing enough to protect those most vulnerable. And so this idea of safety, and that we all have a role in our families, our communities, in our advocacy for safe spaces.
I also just felt tremendous gratitude at the bravery that it took to speak to a group, even though we might assume that the people from the Catholic Health Association of Saskatchewan and those of us gathered here, you know, we're an empathetic audience, but it is still very challenging to share a story that makes you feel that level of vulnerability. You know, I think in sharing that vulnerability, you've reminded all of us of the vulnerability that we are all carrying with us, no matter where we are, no matter how we live right now. We all have the capacity to be wounded. In your stories, the thing that separated you from maybe some of us in the audience is that you became aware of that vulnerability in a very acute way. And we haven't all felt that yet, but we all will at some point in our lives. And so I'm just very grateful to each of you for bringing voice to that. I think it serves as a reminder of all of us that this needs to be taken seriously, that we need to remain awake and ready to defend each other.
Thank you. When I think about so many Canadians asking for euthanasia and the reasons why Canadians are asking for euthanasia, there are many, and it's complicated. I think, though, that every request for euthanasia is not so much the expression of a desire to die, as it is an expression of a disappointment. Euthanasia is not so much about a desire to die as it is an expression of a disappointment. Could you comment on that? Do you have anything to say about how we might be able to be adequate to the human person in distress, in vulnerability? How can we hear the cry of the heart, which is a cry for help, and respond adequately to so many disappointments that people face, leading to despair?
I'm going to ask easy questions, Amanda.
It's what we call a compound question. You know, I think part of it is that in order to hear it, we have to be listening. We have to adopt a listening attitude to be able to hear those moments. In the past, I don't know, I want to say several months in my work as a clinical ethicist, I've received more than one consult from a team member who feels a sense of panic. They've had a patient who they've been journeying with who's been receiving acute treatment, having more and more things done, in one patient's word, done to me rather than for me. And now all of a sudden, in the healthcare provider's eyes, all of a sudden our patient has contacted the MAiD program, which in Saskatchewan is available directly. You don't need to go through a physician to access MAiD in Saskatchewan. So we're panicked. We don't understand why this patient has chosen MAiD when we were doing everything for them. Why are they even contemplating this? And I often ask that care team, did you talk to them about their end of life? Have you talked to them about what their wishes were, how they envisioned their dying? And there's almost this sense of fear. If we had asked him that, he might have told us, you know? He might have told us more than we were prepared to absorb in that moment. On a separate panel that I was doing, I guess it was yesterday, one of the things that I mentioned is, I wonder what this new reality of MAiD would look like for us, having euthanasia legalized. I wonder what it would have looked like if we had been comfortable with end-of-life conversations first and legalized euthanasia second. But here we are in a reality where we've legalized euthanasia before we were comfortable with end-of-life care conversations. And I don't think we're prepared to deal with that, to find the moments to listen, because we're afraid of what we might find.
Yeah, I think opening the door to label and name the things that we're worried about, scared about. And I think I talked earlier today, using the D words actually gives people permission. Like, we're so scared to say, oh, they passed away, and it's like a social nicety, but actually we need to talk about dying and death. And I think that's one of the things I've learned from children that I take care of in pediatric palliative care. Like, they want to talk about what their death is going to be like. They very matter-of-factly will say things like, I know I'm going to die, and but then it gives permission for their families and their caregivers to enter into a conversation about what they're scared about too. And that actually, like you said earlier, we're both wounded. So actually giving space and permission and coming alongside, just being present and not having to fix everything. I think not, in my experience, and I've been doing palliative care for 18 years full time, people don't need us to fix things, but they need us to be with them in it. And that alone sometimes is all that's needed for them to get through what they're experiencing and come to the other side and know their life is valuable and want to be present in the world.
Mm-hmm. Yeah, there's a novelist I really like, and she says, all sorrows can be born if you can put them in a story or tell a story about them. And I think the same holds with all sorrows can be born if you can share them in some capacity. And that's what's inherent in storytelling that she's getting at in the first place. Because we cannot reveal the meaning and the mystery of our own lives to ourselves, by ourselves. That's why autonomy is boring. It doesn't cut it for us. We need the gaze of another who looks at us, a gaze that meets us, that sees us in a way that we are incapable of ever looking at ourselves if not having been met for that gaze. We need someone outside of us, outside of ourselves, to be a kind of prophet of hope, as Pope Francis is calling all of us to be. A prophet of hope who looks to us and says, what your heart deserves exists. What your heart deserves actually exists. And that consists largely in presence. Now, do you have any questions for each other?
So many.
Where to start? Where to start?
Do you have any good recipes for pumpkin pie? Or?
Do you have any good recipes for pumpkin pie? Yeah.
I also want to say that if you are starting to think of questions that you would like to raise, you could start lining up at the microphone anytime, and we'll come to that line once I notice it appearing. Now, we know that one of the leading reasons that people say, according to their own admission, that leads them to request euthanasia is a loss of ability to engage in meaningful life activities. More than a fear of being a burden, more than a loss of autonomy or control, more than even pain or the fear of pain, the top reason why people cite leading to their request is an inability to engage in meaningful life activities. So this raises several questions. Do we ever, as human persons, lose the ability to engage in meaningful life activities? Certainly, we all have lost some abilities over the course of our life. And in what way are we prepared to meet such loss? Even good activities to which we are attached, good relationships, we can lose. Is there a way that we can fortify ourselves such that we do not become debilitated when we lose certain capacity?
I mean, I think that's something that I continue to see a lot is just these, I would call them ableist views of our society. Could be, you know, out of utilitarianism, like we are worthy because of what we do, not because of who we are. And I think that that is part of it's a challenge today in our culture. And so when we're no longer independent and when we have to rely on someone else to wipe our bums and turn us in bed, for some reason we're less valuable and less important. And we have this expectation in the society that we are burdening other people instead of, I think as we talked about earlier today, that we actually all need to rely on each other at different stages in our lives. And I use this analogy a lot because it resonates with people, but we don't ever say when we have to carry around a baby who can't walk and we have to change the baby's bum that that baby is a burden. Or, you know, like, but we for some reason have this sense that if we become incapacitated from illness or aging, that somehow we're burdening other people. And I think we need to shake up this in our culture and be like, no, we are all dependent on each other, and that changes through different periods of our life. And what a gift that we can care for each other at those times of vulnerability.
Mm-hmm. Do you have anything to add?
Yeah, the one thing I would add is that I think it's normal that throughout our lives, the activities that bring us meaning would change. Right. You know, when I look back to 10 years ago before I had children, I went out and I played basketball. I sat on the couch and read a book. I read a book, you know? Now those things aren't so possible anymore. Is my life devoid of meaning? No, the things that bring me meaning have changed. And I think that we don't leave room for that change to happen. All we see is the ending without the hope of the new beginning.
Thanks for sharing that. All right, we'll now come to our question askers. Please keep your questions succinct and for the benefit of the whole community. Thank you for sharing that. I think that's an excellent point because certainly there is a big difference when we suffer a loss that is natural. Still, death is grievous, it hurts, it takes place, and we suffer. But it's very different when death is inflicted compared to when it happens. Because when a person opts for euthanasia, as you touched on, the persons who are left behind are left with the sense that they were not worth sticking around for. Children are left with the sense that they have been orphaned on purpose. Orphaned on purpose. So it's very different. The alienation that happens, the grief that takes place. And yes, it can be difficult to watch our loved ones suffer, but it's worse if they disappear without any of those experiences to which we could be privy. And so thank you so much for sharing that. Would either of you like to comment?
I would just like to say that, in all the years that I've been doing this work, and I go back again to how much I've learned from children, there is so much transformation and growth that happens in that time of life. And even if people don't know it when they're going through it, they can look back and see there's just so much opportunity for reconciliation and growth, even if it's not between people, within a person, and the opportunity to reciprocate care that you may have received from someone earlier in your life. Like, there's just such profound things that can happen. It truly is a sacred time, as you said. And I think we've kind of lost that idea from our culture. Again, maybe this utilitarianism, it's just like, okay, we're done, turn it off. There's something really missing, and I think that's what you're referring to, that gets lost in euthanasia.
Mm-hmm. I remember when I was working as a chaplain for the Archdiocese of Regina, journeying with a man through palliative care. This was before euthanasia was legalized, and we were talking about his funeral. What did he want his funeral to look like? And he told me, I don't want to have a funeral because I don't want my family to cry. Mm-hmm. And I can remember saying to him, like, they are going to cry. Yeah. Yeah. Do you want them to have the support of a community around them while they're crying? Mm. And I feel like euthanasia sort of gives you the same false idea that if you do this, maybe you can save your family that's suffering. And I just don't believe that that's possible. Grief will come with death. That's what's supposed to happen. It's how we respond to that that's going to make the difference.
So my first comment, if I may, and then jump in, is actually, I think Canadians don't actually understand well the laws around euthanasia, and there's been such, like, the language itself has been confusing. Medical assistance in dying, what does that even mean? It's euphemistic. I say I do that every day in palliative care. I help people who are dying, but we don't kill people. And so I think there's just been so much confusion around what MAiD and what euthanasia and assisted suicide are, and that actually it's legal in Canada to get euthanasia if you have suffering and an underlying condition that makes you eligible. That can be any type of disability, hearing loss, like it could be cognitive impairment, it can be a chronic pain. Like, it doesn't have to be a progressive condition that you're going to die from. And I think a lot of people don't know that. Even healthcare professionals don't know. Many doctors don't know that you don't even have to have treatment for your underlying condition. You just have to know that there's something that could be done. And in some cases, very tragically, euthanasia is the only type of intervention, quote unquote, that's provided. So I actually think there's a lot of ignorance. And as a result, the speed of which the legislation has changed has also been part of the problem. So people didn't actually know this was all happening during COVID, right? When all of these laws changed, that was during COVID. And so I think a lot of it is ignorance. So we have a responsibility to educate and help people understand so that people can advocate and speak to their parliamentarians as an important thing, for sure.
Mm-hmm. Mm-hmm. So I have two thoughts, and I hope they'll be connected by the time I stop talking here. So the first is just a reminder that every MAiD practitioner that I have met believes that they are doing the right thing. So I think it can be easy to kind of create this caricature of the person who's supportive of euthanasia, thinking that maybe they're in it for the money, maybe they're in it because they're lazy. That hasn't been true of the people that I have met. But now my second thought, have you ever heard the saying that if all you have is a hammer, every problem starts to look like a nail? That if your toolkit, if you are filled with compassion or a feeling of wanting to help people or be with them or journey with them, and the only tool that society has given you that you can wield easily is this hammer, is euthanasia to be able to do this. It starts to make sense that you would look at people and think, I need to give them this thing that is the only thing that's in my toolkit right now to be able to help them with. I think maybe that's not true for every person who provides euthanasia, because there are some palliative physicians who provide it as well, which are the ones that I just really struggle to understand. Leonie, maybe you can even offer some insight into that, because I just feel like, but you have the other tools, you have the other resources. Why aren't you committing yourself to using them? I'm at a bit of a loss in those circumstances.
Yeah, I would say that it's very few palliative care physicians, by and large, if you look internationally, that it's the most largest group of opposition to legalization of euthanasia is actually the people who face death every day. So palliative care physicians, particularly geriatricians. But there are a few, of course, and I think that the personalities of those physicians might have something to do with it, where that they feel the need to have to fix everything for everybody, as opposed to being uncomfortable with some things we can't fix. And so I've certainly seen that in my work. I don't think that's, broadly applicable, but I think, like anything, there's a spectrum of personalities that are drawn to certain things. So.
Yeah, thanks for those points. I'm remembering reading a memoir by a euthanasia doctor in Canada, because I wanted to try to understand what could possibly motivate someone to prematurely end so many lives. And in particular, I was interested in how she talks about the Hippocratic Oath and says, in fact, I would be doing harm not to kill my patient. The illness is killing them, and I'm simply kind of expediting it. So this inversion of what it means to do harm was there. But I was also very struck because she tells a very candid personal story throughout this memoir. She describes suffering her parents' very traumatic, for her, divorce. When she was just 13 years old, her parents separated. It was very fraught, and she goes into quite a bit of detail about that. And then she says, the way that I needed to compartmentalize due to my parents' divorce enables me to compartmentalize such that I am able to do MAiD. That is her own account in her personal memoir, an admission that her participation in this evil and in this false compassion comes from her own deep woundedness and brokenness. And indeed, reading that, I think, is a help to me against the temptation to dehumanize those who I would consider dehumanizing of others, and moves me to pray even for those who are participating. And perhaps we can all, in a special way, pray for those who are both victims and perpetrators of this injustice, because we will their good. And what makes our position so unique is that we want the best for everyone. We want life and flourishing and adventure and companionship and communion for absolutely everyone. This is not an exclusive aspiration, because this is what's adequate to every human heart. Thank you. I can't resist mentioning that I interviewed an 88-year-old woman who, after the legalization of euthanasia, decided to get a tattoo right here that says, "Don't euthanize me." So I'm not saying that you necessarily all need to go get tattoos with that, but maybe we can turn to...
But actually, the disabled community in Canada and groups like Inclusion Canada have been advocating and providing resources to people with disabilities, because they are scared to go to healthcare facilities now. Like, there's been lots of campaigning and education to say, don't go to the hospital alone because you're in a state of vulnerability. If you're acutely unwell and you go to the hospital and you have euthanasia suggested to you not just once but multiple times. I've had one patient who told me she had it offered to her 6 times in one hospital admission. And eventually you might get to think that, geez, I really am a burden, right? So I think there are people carrying around cards that say, don't offer me euthanasia. The tattoos, there's many people getting
signs
those
outside
now.
of different places that say we will not offer.
And so that's one of the things the disability community has come out and said. Can you, if you are a safe clinician, can you let people know that you're not going to suggest euthanasia to us, bring it up unsolicited? And that's one thing I think we can think about, and also advocating for pluralistic safe spaces. That is such an important need for within our Catholic healthcare system, for example, and other, like we have a hospice in Calgary as well, that's Salvation Army, could be Jewish, but just places that openly say, we provide a safe space for you here. And people who don't want to have euthanasia suggested to them or have that inflicted on them can choose to go to those places because they're safe.
Thank you. Do you have anything to add before we come to our final question?
You know, I'm kind of, I'm pondering a lot. And one of the things that I just would really encourage all of you to think about is, if you are in a situation where you're in the hospital, probably one of the things that you can do to diffuse the euthanasia conversation very quickly is to state quite openly that you're looking for palliative care. To not be afraid to talk about what it is that you want your end of life to look like. It can feel like a very taboo topic, especially if you're with a healthcare team that is always talking about cure all the time, you know, that we're going to go, go, go until we've fixed you. To try to shape the conversation, to take control of that shaping, to say that this is actually the approach that you would like, is to be met with that compassion, with that palliative approach. I also very much appreciate the comment to go in numbers. You know, even before euthanasia was legalized, before we were even talking about MAiD, I think that was probably good advice in the healthcare system, because there are just so many different pressures at play the moment that you come into the hospital, that having an advocate who is with you by your side, understands your values and how you want those to play out. I think that's good advice, whether you're in labor or in delivery or nearing the end of life.
Thanks.
Just wondered.
Well, and it's a big problem in places like Quebec right now. So they have mandated that all hospices have to provide euthanasia, even, like, it doesn't matter if you're a religious facility or not. And so it's really causing a lot of distress, not just for patients and families, but also the staff, because it is so counter. And in fact, I would say it's like euthanasia and palliative care are actually diametrically opposed in terms of their philosophy, intention, and approach, which I talked a bit briefly about earlier today. And so actually, all the international hospice palliative care associations have clearly said, including all of the ones in Canada, that this is not part of palliative care and is not congruent with palliative care. People can choose to access MAiD separately, but it shouldn't be part of palliative care. And so we're really trying to advocate to have hospices that are allowed to not provide euthanasia. And I think that is an important piece of advocacy for you to think about going forward, that we need dedicated safe spaces, whether they're long-term care homes, hospices, palliative care units, where people are not going to be forced to have euthanasia suggested to them or worried that it's going to happen in the next room.
Right. Thanks.
Right. I think it's a reality too that our healthcare professionals are all on a journey as well. You know, we might want to envision the perfect palliative care nurse who's probably, you know, nearing the end of her career, but not too close to the end of her career. She's compassionate. She's probably been a mother in the past. You know, we have all of these visions of what this person might be. But the reality for each of our healthcare professionals is that they have their own history, their own story that brought them into whatever context they happen to be in. And for some of them, they might be in palliative care and be struggling with these questions around end of life, around whether euthanasia is good or bad or whatever on their own journey. And so you've kind of asked this question about how can they provide good palliative care. I would have that question for them. I think that's part of an understanding and a journey that probably each of them is on. And what I would hope that we would be able to do as a faith community is to provide places where those questions can be asked. where that can be explored with them, or we run into a situation where we stop having the conversation and maybe then our voice is cut out of that conversation.
One way that we can really drive home how incongruent these things are is by discussing how we are in tension between providing suicide assistance to some and suicide prevention to others. Why would some people deserve suicide assistance and others deserve suicide prevention? And if you want to diagnose the social inequalities, it's simple. Whoever gets suicide prevention is in one category and suicide assistance another. This is a clear injustice that we must work to fight. Everybody deserves suicide prevention. This is why I like to insist that euthanasia is quite literally the opposite of love. Because love says, it's good you exist. How wonderful that you are. I want you to be. Euthanasia sends the exact opposite message. I'm not sure it's good for you to be here. Maybe you would be better off dead. But we know that we are called to be prophets of hope, and that this issue touches all of us across demographics, across ages, across backgrounds, and this can become a common ground issue to humanize our society and rehabilitate the dignity in which we all deserve to live. So let's conclude by thanking our panelists as we come to the end of the program.